All righty, folks. It looks like we've had a couple more folks join us. So if you're just now joining us, we'd love for you to tell us who you are. You can share where you're from in the chat if you're representing an organization or a member of the community. But we're going to go ahead and get started because it looks like we've got all of our folks lined up. So thank you so much for joining us for our second quarterly State of Disability Pride in South Carolina Town Hall with ABLE South Carolina. My name is Mary Alex Kopp. I am the Chief Public Relations Officer at ABLE South Carolina, and I am just going to be kind of helping guide some of the conversation today before we turn it over to our official speakers. So a couple of quick notes on some Zoom rules and how to ask questions. Your microphone will be muted until the end of the presentation. After the presentation, we will answer your questions. You can use the Q&A feature to send your questions through the presentation, and you can also ask to be unmuted to ask your question directly to the presenters. But again, that will be after the presentation is over. It is a great idea to write your questions down as you think of them. You can, of course, already submit them in the Q&A feature, or if you want to write some questions down and ask them at the very end, you are welcome to do so. So go ahead and get something to write things down now before we get started. Also, we do have ASL and captioning available. If you are having any difficulty viewing the ASL interpreters or accessing the captioning, please let us know using the chat feature. We have two individuals on our tech team, Renata and Alyssa. They'll be happy to help you. Renata is going to be the primary person from ABLE South Carolina who will be responding to questions in the chat today. Okay, and without any further ado, I'm going to turn it over to our ABLE South Carolina speakers. Larry, if you want to introduce yourself first, and I'll let the others follow. Larry, you are muted, my friend.
All right. You'd think by now I'd know how to operate Zoom. Um, I'm Larry Wanger. I'm the Vice President and Chief Advocacy and Independent Living Officer here at ABLE South Carolina. And thanks everybody for joining us this evening.
Hey everyone, so happy to see you all. I'm Kimberly Tiso. I'm the President and CEO of ABLE South Carolina.
Welcome everyone. My name is Allie Springate and I am the Director of Advocacy here at ABLE South Carolina. And I think I'm kicking us off with our next slide. So we're going to talk briefly about what disability advocacy is, just as a general reminder for our folks who have been with us before. And this may be some newer content for people who haven't been with us before. So disability advocacy is taking action to create equal rights, access, and opportunity for all people with disabilities. Policies and laws that impact disability should be influenced by people with disabilities. Our advocacy says no to ableism in systems, and those systems include healthcare, education, employment, housing, voting, etc. We are staunchly nonpartisan, which means that ABLE-SC does not take sides with any political group. ABLE-SC and this event are nonpartisan, and we advocate for change that benefits disabled people. So not political candidates or groups, but across the board, any change that benefits disabled folks. We call out leaders when policies harm disabled people. Let's go on to the next slide. And this is our agenda for this evening. So today we're going to talk about healthcare. We're going to do a brief recap of the Medicaid changes from at the end of this summer. We're going to talk about Affordable Care Act changes. And then in regard to SNAP, we're going to do another recap of changes from our previous town hall back in July. And then we're going to discuss Governor McMaster's executive order that was sent out on September 4th. We're going to move to federal budget and its impact on disability programs. We're also going to talk about federal staffing reductions on October 10th. And then we're going to talk about a South Carolina bill called S323 called the Unborn Child Protection Act. And then we're going to move to airport regulations for wheelchairs and disabled passengers. And then finally discuss Advocacy Day 2026 and other ways to get involved with ABLE South Carolina and with advocacy in general. So let's go on to the next slide, and I believe I'm turning it over to Larry. Wait, hold on. No, it's still me. Still me. So sorry. I'm going to go over the Medicaid changes that we discussed at the end of July with our first town hall. So let's go on to the next slide, please. As a reminder, these are some terms that you'll likely see fairly often. So just briefly going over the basics of Medicaid. What is Medicaid? Medicaid is a government health insurance program that helps people with low income, including children, pregnant women, and people with disabilities, as well as older adults, get the medical care that they need. Medicaid in South Carolina is called Healthy Connections. So what is Medicaid expansion? Medicaid expansion means that more people can get Medicaid health insurance because the rules were changed to include more adults with low income, even if they don't have children or a disability. So that's Medicaid expansion. What is Medicaid non-expansion? And that just means that a state has chosen not to expand Medicaid. In non-expansion states, many low-income adults fall into what's called a coverage gap, which means that they earn too much for traditional Medicaid, but not enough to be able to buy plans on the Affordable Care Act marketplace. South Carolina is a non-expansion state. Let's go on to the next slide. Okay, as a reminder, this is a chart that we made to help visualize the changes that have happened and are going to happen when it comes to healthcare in the United States. So I'm going to direct your attention to the left-hand side of the screen where our timeline starts. And you'll see that today, as of July, but this is still true today, the SC Pathways to Independence program is still waiting on approval from CMS. As of August 25th, 2025, access to Affordable Care Act marketplace plans ended for DACA recipients, and DACA means, or the acronym there means Deferred Action for Childhood Arrivals, or children who came to the USA, grew up here, and are now adults. In January of 2026, we can expect Affordable Care Act marketplace plan costs to go up dramatically. And then from October 2026 to January 2027, we can expect that immigrants will have limited or removed access to Affordable Care Act marketplace plans and Medicaid. From January 2027, nationally, work requirements and eligibility reviews every 6 months will begin for expansion states. In January 2027 in South Carolina, the third month of retroactive coverage will be taken away, and then you will only get 2 months before your application retroactive. South Carolina will begin phasing out state-directed payment program, causing hospitals to lose money and Medicaid funding. In October of 2027, new out-of-pocket costs will begin for adults in expansion states. New verification requirements for Affordable Care Act marketplace plans start. In January of 2027, Affordable Care Act marketplace plan auto re-enrollment and provisional enrollment ends. This could kick people off their insurance without their knowledge. Let's go on to the next section, and I will turn it over to Larry.
All right. We're going to go ahead and jump into talking about the Affordable Care Act specifically, because there's a lot of concerns around that right now. So on slide 10 here, just some background and clarification so we're all on the same page. The Affordable Care Act, also known as ACA, and sometimes it's called Obamacare. And it's a law that was passed in 2010 with the goal of making health insurance more readily accessible and affordable and fair for people. So there's been a lot of controversy and discussion about the Affordable Care Act really since it became law. There's a lot of conversation currently because it's at one of the issues at the center of the government shutdown that's currently happening, and we'll talk about that in a moment. One of the things that the ACA does is establishes a marketplace or really a place online where people can go to look at different possible plans they could participate in and decide which plan they want to sign up for. And the Affordable Care Act also provides financial help or what we call subsidies for people to help them be able to afford coverage, especially people who are lower income or may have larger families. And a subsidy, as I said, is financial help, something to make a way to make things more affordable for people, or a discount, if you will. So we'll go to slide 11. And we want to talk about what are called temporary or enhanced subsidies. And so this is the specific issue that we want to focus on that is really at the core of the government shutdown currently. Back in 2021, when we were still dealing with the pandemic, Congress approved and the president at that time signed legislation that created a way for people to get financial assistance to cover the cost of their ACA plan. And those subsidies are set to expire at the end of this year. So when we wake up on January 1st, unless something changes, those subsidies will have expired. And so what that translates to for consumers or individuals who receive or participate in Affordable Care Act plans across the country is higher premiums. And we're in a situation right now, I don't think I have to tell anyone, where costs keep rising, not just healthcare, but general living costs keep rising. And for a lot of folks, things are pretty tight right now. Without these possible loss of subsidies and increased cost of health premiums, doctor's visits, healthcare, hospital visits, et cetera, just keep going up every year. Where this has put people is that individuals and families are potentially going to face some really tough choices about what they can and can't afford. And if these subsidies expire, it's going to be a real challenge for a lot of folks. It's not on the slide here, but pretty widely reported, and I've seen numbers that show South Carolina's in the top 10 of states that will see the highest increases in premiums. And other southern states are in the same situation for a variety of reasons. So what's going to happen? What can we do? People who are currently participating in and we're on slide 12 now. People who are receiving or participating in ACA plans are soon to receive a letter within the next couple of weeks. Some folks are just receiving them now. The letters will provide information about things like key dates to be aware of, so enrollment and how much time they have to make changes to the plan they're in, what their premium will be, potential plan changes, so maybe their plan that they're currently in won't be available. They may need to provide other information to prove eligibility, right? So these letters are going to have a lot of information, but the key piece is, what is your premium if you stay in your current plan going to be next year? And without these subsidies, it's going to increase significantly. And folks can use a marketplace calculator to really, there's lots of that online. We're going to look at some examples from a calculator we used at the Kaiser Family Foundation. We'll talk about that in just a minute. You'll be able to estimate how much your premium is going to increase if you haven't gotten that letter, but you're an ACA plan recipient. So we'll go to slide 13 and talk about the impacts. So in South Carolina, we have not adopted Medicaid expansion. And what that translates to is a higher number of people, especially low income people, who are, participating in Affordable Care Act plans. About 570,000 people in South Carolina participate in ACA plans. So it's a pretty significant number. 95% of the people in South Carolina who are receiving or participating in ACA plans, so 90% of that 570,000, 95% are receiving subsidies. So you can see that the loss of these subsidies is going to be a huge impact on people in our state. And we expect if the subsidies expire and are not renewed, that many people will be forced to make really difficult choices about, paying for groceries, paying for their insurance, or going without health care. So we'll go to slide 14. What does this mean? Again, as we've said, for many who don't get Medicaid, who may not get insurance through their employer, ACA marketplace plans are the only option. And if subsidies are not renewed, it's going to be a pretty significant issue. I apologize, I'm having a computer issue. Oh no. Can you all hear me?
Yes, we can still hear you, Larry.
Your default speaker has.
Can you hear me?
Yes, we can hear you.
We can hear you, Larry.
All right, there is some technical difficulties, so I'm going to go ahead and fill in for Larry until he gets back. So what does this mean? So when the amount of insured people goes down, that means that will be fewer marketplace plans options, and there are several different plan options that can actually increase depending on the health conditions that you may have. So there are plans that will be at a higher rate, and so that is depending on your health. So the basic plan is the silver plan, and that is something that is also already uploaded in the KFF calculator. This also means that people who keep their insurance will have fewer choices and pay even higher costs. And so there is an assumption that people with disabilities are not on the Affordable Cares Act. And that is a myth. People with disabilities are not only on Medicaid or Medicare, they're also on ACA. They're also have private insurance through employers. So it's a very diverse options for people with disabilities. But there are a lot of concerns within the disability community, not only here in South Carolina, but on the national level, because we are very concerned about when these ACA rates go up without the subsidy, that people will no longer be able to go to their doctor's offices. But we're especially concerned about medication because medication often keeps people alive. And so that is something that our organization will be advocating for heavily. All right, we'll go to the next slide. And so here are a couple real world scenarios. And so this is a KFF calculator. And if you scan this on the QR code, you can actually go to the calculator and just put in some figures to figure out what your payment may look like. Starting in November, around November 1st, South Carolina will be issuing letters that will state how much your premium will be going up as well. So with everything considered in your particular plan. So here's the situation. So for a family of two adults in their 40s with an income of $40,000 a year, the cost for one silver plan would go from $52 a month per person to $203 per month. So that is a significant increase. So the family of four, or for the family of two, that would be rather relatively expensive for the ACA rate. Also, for a family of two adults and two children with an income of $80,000 a year, the cost for one silver plan would go from $263 a month to about $560 a month. So it is a couple in a couple hundreds, and it really depends on what plan you currently have.
And we have put a QR code on the screen that you are welcome to scan to try the marketplace calculator for yourself. And there's also a link in the chat.
And so the major reason why the government is currently shut down is, and remember, we are nonpartisan, but I'm just going to let you know some of the facts right now. So Democrats are saying that the expanded tax credits make health insurance affordable for millions of Americans, especially low and moderate income families. They support extending the tax credits. Then Republicans are concerned about the federal cost of maintaining or expanding these subsidies. Some want to limit or phase out the tax credits and reduce government spending. Others want to look at other approaches to healthcare coverage or premium assistance. So what's happening right now is the two parties cannot agree, and that is one of the reasons why the government is currently shut down.
And Kimberly, Larry is back. So
All right.
Larry, if you want to jump on and wrap up this portion of today's presentation.
I have no idea what slide you're on. You're going to need to give me a minute.
That is okay. We are on the last slide listed as slide number 16, further explanation at the end of
Okay.
the Affordable Care Act presentation.
Okay. Give me one moment. So I'm sorry, I literally just jumped back on. You're done with 16?
We are wrapping it up, and I'll help tie it off here. So Kimberly just read through the slide explaining the major reason why the government is currently shut down. And a member of our team has put in the chat a link to look up who your federal legislators are if you want to reach out to them about the current happenings. Larry, if you'd like to just wrap up this conversation with a little commentary on how people can engage their lawmakers, please.
Okay. I apologize. Just didn't expect it to be thrown to me so quickly. I'm catching up here. The important takeaway from this part of the conversation is that we really encourage folks, especially if you're impacted by the potential loss of the subsidies, to reach out to your federal representatives and senators. We've dropped a link in the chat, or will shortly, that you can use to identify who your senators, federal senators, and federal representatives are. They need to hear from you and know that this issue is important to you and hear your story about how this might impact you. So we encourage you to use that link and otherwise reach out to your federal representatives and senators to let them know. We'll go ahead and move forward then, and I apologize for the difficulties. My internet decided it was a perfect time to stop working. So we'll move forward and talk about SNAP. And we talked about this back in July, supplemental assistance for the SNAP program, supplemental nutrition assistance program, easy for me to say. And we talked about this back in July, but we just wanted to recap what is changing with the program. And then we'll talk about, again, some immediate concerns that are kind of a direct result and fallout from the government shutdown and how that might affect SNAP recipients. So the program, as we probably all know, it helps lower income individuals be able to access food, purchase food. Each month, folks who are participating in the program receive a card, kind of like a debit card, that as they use it, debits money from their account and allows them to purchase food. In South Carolina, I did some research about this, and it seems to hover around 565 to 570,000 people per month at any given time seem to participate in the program. That fluctuates a little bit. So you can see that these changes potentially impact a lot of folks. The important takeaway is that, especially as we talk about future implications, is for you to know that SNAP is not a mandated program. It is optional for states to participate. Most states do, but it's not mandated. We'll go to slide 19 and we'll talk a little bit. There's a chart here that summarizes some different categories that I'll talk about here. And then it shows you the law, the SNAP program and how it was structured prior to HR 1 passing back in July, the Budget Reconciliation Act, and then how that legislation changed the program and the new requirements. So as far as work requirements, under the previous rules prior to July of this year, anyone between the ages of 18 and 54, well, many people, let me say it that way, many people between the ages of 18 and 54 who were receiving SNAP benefits had work requirements they had to meet. That has changed now and increased to age 64. And the term you hear sometimes is able-bodied people who can work. I'm not a big fan of that term because obviously it's ableist and really not appropriate, but you see that term thrown around a lot. So they changed it to 18 to 64. There were set number of hours folks who were subject to these work requirements had to meet, and it was 18 or 80 hours per month or 20 hours a week. That did not change, right? So that's still there. There was a change though to who had to meet these work requirements. So it excluded several categories previously, and that has changed now. As of 2030, so it's down the road a bit, but as of 2030, now veterans, individuals who are experiencing homelessness, and youth who are previously in foster care will also have to meet work requirements, this 20 hours a week or 80 hours a month, to receive SNAP benefits. The additional group impacted is parents or caregivers of children. So previously, SNAP recipients who are parents or caregivers that were caring for children under 18 were excluded from the work requirements. That age has been reduced to 14. So there's some concern about, about that, because youth who are, 14 to 18 will not, parents of those youth, I should say, will now have to work and make arrangements as needed. The eligibility rules, fortunately, did not change. They're staying at 12 months and not being increased. So that's good news, at least. The important takeaway from here for folks who are disabled folks is that people with disabilities who receive SNAP benefits are excluded from these work requirements. So that has not changed. We'll go to slide 20, talk about some additional changes, and this has a potential impact down the road. For the first time, states are now being required to pay for more costs related to the program starting in October of 2027. The SNAP, there's an issue with the SNAP error rate, and that's when people receive SNAP benefits when they should not. So that's the percentage of people who, percentage of too much or too little benefits paid, but just think of it as the error rate. It's been shown that most of these errors are not fraud, it's mistakes with paperwork and that kind of thing. They do happen. So starting October 1st of 2027, states with an error rate of greater than 10% must start paying for 15% of those benefits costs. Our error rate in South Carolina last fiscal year was just below that 10%, just above 9%, right in the middle there. So we're in good shape for now. but that rate changes every year, so we have to watch that. We'll move to slide 21 and look at other potential changes or other changes that are happening. I'm sorry. The federal government paid 100% of SNAP benefits previous to the HR 1 passing, and states like South Carolina who participate in the program only paid administrative costs. Now we're in a situation where SNAP is transformed to a cost sharing program similar to Medicaid. South Carolina will foot some of the bill to provide the SNAP program for people. So it's a shared program now. We're concerned it will make the program less stable. So we'll go on to slide 22 and talk about kind of the third issue related to SNAP. There's a couple of them here, but this is really paramount for people right now who receive SNAP benefits. Today, we've been concerned, let me back up, we've been concerned about, with the government shutdown, what will happen with SNAP benefits. So October benefits, fortunately, were paid out. They were okay. But now there's concern about November, and in some states, they have notified SNAP participants that they will not receive SNAP benefits in November if the government shutdown continues. Today, Department of Social Services here in South Carolina issued a statement that the term they use is may. SNAP benefits may not be available if you read the official language, but essentially, SNAP beneficiaries should not expect their benefits in November if the shutdown continues. The DSS has encouraged folks to identify food banks and other food resources in their community where they can obtain food, expecting that benefits will not be available. And we here at ABLE SC are also encouraging people to do that. Our information and referral team is working to make sure that the information we have about food resources and food banks is up to date. And we plan to make that widely available in the coming days to the community and get that information out. So we're encouraging people that if you have a need, we will be working to provide information about options for you as well. We'll move on to slide 23. On September 3rd, our governor, Governor McMaster, issued an executive order ordering DSS to request or to make a waiver to the federal government to make changes to
Your default speed.
To make changes to the sorry, my computer's talking in my ear. To make changes to the SNAP program. So to the Department of Agriculture, that waiver request was to make changes such that certain items will no longer be able to be purchased in our state with SNAP funds. And that would be items such as candy, energy drinks, highly caffeinated drinks, and soft drinks. You still would be able to purchase certain items. There was concern, for example, can people buy a birthday cake for their child? And the answer is yes. So certain milk-based nutrition drinks, milk-based type things, those types of purchases will still be okay. That waiver is still pending and has not yet been approved. And so there's no final word on this, but we're expecting to hear something soon, I would imagine. So those are the major changes with SNAP. And I will wrap up and hand it over to, I believe, Kimberly's next.
Nope, it's me. Surprise.
Okay.
It's Allie again. So just briefly, though, I'm going to go over some federal budget proposals for some critical disability programs in the nation. So if we'll go on to the next slide, I'll show you a chart with some numbers. Okay, so on the screen, you'll see a chart, and 4 programs are listed on the left: independent living programs, developmental disabilities councils, projects of national significance, the National Institute on Disability, Independent Living, and Rehabilitation Research. And so what you see before you on this chart are the proposed funding amounts for these programs for this next fiscal year. So for independent living programs, the proposed amounts in the House and the actual amounts in the House for the budget proposals and the actual amount in the Senate are the same, 128 million and change, 128.183 exactly. For developmental disabilities councils, the actual amount in the House that was proposed, as well as the actual amount in the Senate, are also the same at $81 million. The projects of national significance, the actual amount in the House and the actual amount in the Senate, also the same number, 12.25 million. And then finally, the National Institute on Disability, Independent Living, and Rehabilitation Research. The actual amount in the House and the actual amount in the Senate are 2 different numbers. The House is 100 million and the Senate is 119 million. So I just wanted you to be able to have a visual or an understanding of the numbers for this next fiscal year. And on the next slide, I'll explain a little bit about what that means. So although funding for many disability-related programs is still uncertain, we wanted to show that funding for critical disability programs should continue into the next fiscal year. And then just as a reminder, independent living programs are there to help people with disabilities live more independently in their communities. Developmental disabilities councils advocate for the rights and needs of people with developmental disabilities. Projects of national significance, pilot programs, and innovative projects that improve disability services nationwide. And then the National Institute on Disability, Independent Living, and Rehabilitation Research conducts research to advance independent living, rehabilitation, and accessibility. And please know that I am reducing the vast amount of work that these programs do into one sentence each. So there is so much more that goes on in these programs individually, but just at a bird's eye view, this is what each of them are kind of distinctively known for. And yes, as Kimberly put in the chat, Able, South Carolina specifically is a center for independent living. So the independent living programs applies to us. All right, and let's go on to the next slide and I will turn it back over to Kimberly.
All right, great. Thanks, Allie. I'm going to talk a little bit about the government staffing reductions. I'm sure everyone has seen in the news that the Office of Special Education Programs at the Department of Education, the Rehabilitation Services Administration, and the Substance Abuse and Mental Health Service Administration has had most of their staff laid off. And so there was a reduction of workforce. And so what does that mean for us? So we're going to go to the next slide. All right, so the staffing reductions, we're going to first start a little bit about who's been laid off. So the federal government has laid off almost every single employee in 3 of these agencies. So Office of Special Education Programs within the Department of Education, what that does is that oversees IDEA for students with disabilities in the school system. IDEA allows students to receive equitable education in the least restrictive environment, and they are also required to receive free inappropriate education. Without OSIP, there is no one ensuring schools follow IEPs or that families can appeal with the rights violated. And so that is a significant concern because usually annually, or pretty much annually, there's significant amount of complaints that are made to the Department of Education to help the states with navigating the special education programs. Next slide. There's also more staffing reductions in the Rehabilitation Service Administration, and that is the agency under the Department of Education that oversees the vocational rehabilitation programs. And so obviously without RSA, states will lose the accountability and quality check, and it also risks risks discrimination and poor service delivery. So that is, the federal government really oversees and ensures that not only are disability rights being followed, but they're actually delivering the programs that they need to ensure that people with disabilities have equitable access to employment and services. And last but not least, Substance Abuse and Mental Health Services Administration, SAMHSA. SAMHSA does have some program funding within the Department of Mental Health. It protects access, safety, and quality in mental health and addiction programs. So without SAMHSA, there's no federal guardrail to ensure that people with disabilities, people with mental health disabilities, are receiving any equitable care. And so I do want to just take a moment to explain how the federal funding works. So federal funding actually funds a lot of the programs in South Carolina. So just because you're hearing that there's federal reduction of workforce that is occurring, does not mean that it would not impact South Carolina. So these federal agencies actually oversee the federal money, but most importantly, the federal disability rights laws to ensure that people with disabilities, again, are having access in the community. And so we do have concerns that within this reduction of workforce, that this could potentially move into another direction, and that would be directly to the states. And so there has been talks about that, or either moving some of these departments over to the U.S. Department of Health and Human Services, which would be very different, and it would also be a federal law change as well. So next slide. And so you also probably also saw on the news that October 15th, there was a federal judge that has temporarily stopped the administration from laying off federal employees during the current government shutdown. So it's basically against the law to do that while there is a shutdown going on, and employees who are about to be laid off or terminated can continue working or be paid through this process. So while the government is shut down, these employees can actually get paid during this time, which is really important. So this ruling saved over 3,300 jobs from being laid off right now, but we do not know what that will look like after what the final answer will be within the court system. We will go to next slide. And so why is oversight important? Disability rights were established really on the federal level, and people with disabilities are the ones that are responsible for passing every single one of those disability rights laws. It was people with disabilities behind fighting for rights, and we were able to pass such laws such as IDEA, the Americans with Disabilities Act, Section 504 of the Rehabilitation Act. But why is this important? This is not about politics, and we do want to make sure that you all understand that disability is nonpartisan, and people with disabilities are within all parties. But it's about accountability, safety, and the future of our country. So oversight keeps the system honest, making sure that it is preventing waste to make sure the money is being spent properly and following the law. It ensures that people aren't being discriminated, and if they are being discriminated, that there's actually an action. We do have concerns that when a state takes over the accountability of a program and oversight, that states do not necessarily do a very good job with accountability for the state. So discrimination claims would not be able to be brought up to the federal level, but it would have to probably end up in a private lawsuit, which would put a significant burden on people with disabilities. There, is no one left at the federal level to ensure the laws are followed right now, and so there has been a lot of civil rights offices that have been closed throughout all of the federal agencies. So if you are having difficulty having your rights enforced, please let us know. Please contact us. We will be happy to help make sure that this goes to a higher level, since this is still part of the federal government's requirements. And then when oversight disappears, It's our rights, and that is exactly what we're afraid of. When rights disappear, our children, families, and the future are at risk. And so the way that we're looking at this is Department of Education, the Office of Special Education Programs, for example, they are responsible for educating people with disabilities, students with disabilities right now, and that is our future. And so we've got to protect that. Next slide. And then oversight at the federal level is best, especially with disability. And I'm sure that you all are aware that our state is involved in a Section 504 lawsuit currently because our Attorney General does not think that Section 504 should be withheld within the federal government, but they also think it's unconstitutional. So that's something that we are currently fighting for right now. So that is exactly the reason why we do not want any of these federal programs to go to the state because of misinterpretation of the law, but also not truly understanding the importance of disability rights. So, but what does it do? It ensures all students with disabilities receive support no matter what state they live in. And so we could also see this going from, states are going to be delivering systems differently. So if it does go to the states, that is going to be a significant concern because maybe one state is going to provide better education than another state. And so it's really going to depend on the state that you live in. And that is not obviously equitable or fair to people with disabilities. It protects federal law. So again, guarantees that the IDEA and guarantees that individuals, inclusion and parents are involved. It maintains accountability. So federal oversight, again, monitors the school. And then it also reduces the disparities. So unequal access or services based on state funding or policies, we definitely we do not want that to disappear. We will go to the next slide. And I do want to let you guys know just a fun fact. It's not really fun. It means there's a lot of advocacy that we must do. But originally, when the IDEA passed, and this is actually in the current law, it promised that the federal government would pay 40% of the excess cost of educating a child with a disability, which is basically above what it typically takes to provide general education to a student without a disability. But in reality, what this has looked at, and this has been for decades, our federal government has only gone from 15% to 20% of paying that 40%. So that is also the remainder is really left up to the state. And again, states are not required to fund some of these programs. And then states and districts fill the gap. So because the federal funding is insufficient right now, states and local governments must cover. So the majority of the special education costs often strain the South Carolina budget. And that's what we're really focusing on right now is, because some of these services are optional to the states, it's a federal mandate. But the funding that from the state is optional. That is what we're trying to definitely stop. And then this means that resources are limited to special programs, trained staff therapies, and classrooms. And so this is, IDEA allows students with disabilities to receive not only the special education services, but they do speech therapy, they do physical therapy, occupational therapy. So it's really important. We will go to the next slide. And so what can we all do now? And so you will see another QR code on your screen. This will help you connect with policymakers to restore and fully fund federal programs, but to also protect the staff who implement the programs. These are the experts, and they are the ones that know these laws from front to center, and so front to end. And so we definitely want to make sure that their jobs are protected because we do not want to lose that expertise. So definitely take a photo of the QR code. and you will be connected. Well, not automatically connected, but you will be sent to a page where you can reach out to your members of Congress to ensure that they know how you are feeling, but you're also advocating for them to restore funding, but also the staff. Next slide.
We also have provided a link in the chat for those who may not want to use the QR code as well. So if you would like that link, it is also in the chat.
Thank you, Mary Alex. All right, and this is the last policy update that we just want to let you guys be aware of. And so this is very sensitive material, so we are going to be talking about abortion and sexual assault. So I just wanted to let you all know that we are going to move on to the next page, and we're going to talk a little bit about what this bill could possibly do to people with disabilities. And so this is something that we have been advocating and educating the members of the General Assembly with how this could actually impact the disability community. Next slide. So right now, South Carolina does have a law that bans most abortions once a fetal heartbeat is discovered. And so that's cardiac activity is detected, which is usually around 6 weeks of pregnancy. So right now in South Carolina, abortions are illegal. There are exceptions in the law to medical emergencies, fatal fetal abnormalities. Sorry about that. And the case of rape or incest. And people with disabilities do have 3 times, they're 3 times more likely to be sexually assaulted or be in a domestic violence situation. And so that is something that, when we saw the new bill come up, our red flags are going up. But the 6-week ban was challenged in court, but in May of 2025, the South Carolina Supreme Court upheld it, a ruling of 5-0, and the law is valid and consistent, so it is illegal. But because of that ruling, the state keeps enforcing the ban. So now most abortions are legal after the 6 weeks of pregnancy. But let's talk about this new bill. So this bill is a Senate bill. The S means Senate. So Senate Bill 323, and how it will harm people with disabilities. And so I do want to make sure that everyone knows that IVF and fertility treatments are often very unaffordable and unavailable. But people with disabilities are often needing to use it. Maybe they cannot carry a pregnancy. Maybe they do not produce eggs. There's a number of different reasons, or it could be dangerous to somebody's health. And so there's so many options around IVF. And so, uh, and this is one way that people become parents. And so what this bill currently does is it redefines embryos as a legal person. So it risks shutting down fertility clinics or making IVF unaffordable and inaccessible. Pregnancy obviously could be forced even when unsafe. And so that is something that we are extremely concerned about, because some people do not know if they're going to have complications until they do get pregnant. And so sometimes it may not be a good for the individual. It could be a number of different things that could be happening with the fetus or the unborn child. But also we're very scared that doctors may hesitate to act with realizing that somebody may need to end a pregnancy because of their disability. And so that is something that we're concerned, because what we don't want to see is doctors being so afraid to act that they don't act and somebody's life is at risk. Next slide. There's also narrow emergency exceptions, so it completely ignores any psychological or emotional harm. So the law's emergency exception includes psychological or emotional harm, excludes. Yet for many people with disabilities, including those with chronic health and mental health conditions, this is a serious risk. So ignoring mental health and laws denies a full spectrum of disability. So that is a concern within some federal laws. You can't just look at a segment of the disability community. And then providers may refuse care due to the legal risk. And so that's a threat of criminal exposure, may cause providers to refuse treatment altogether. And so that would further isolate folks with disabilities who already struggle to find accessible and disability informed health care. Next slide. Birth control, and so related medications. So birth control could possibly not be not be provided under this bill. So not only provided, but it could become illegal. And a lot of times people with disabilities, women with disabilities, rely on birth control to regulate their hormones or to make sure that they have all the vital hormones that are going into their system to protect their bodies. And so this is extremely concerning to us because a lot of people do not take birth control for contraception. It's usually, sometimes it is for medical reasons. Disabled survivors of sexual assault may have to be forced to carry pregnancies. And again, a lot of times, when individuals with disabilities are raped, sometimes it's their caregiver or unfortunately a family member, and they've already been so traumatized that forcing them to have a child is just going to significantly cause trauma, and it will deny basic rights. So we are concerned there. And then disability rights are grounded in self-determination. And so what we see here is people with disabilities must have their voices respected in healthcare. And S3223 takes that actually away. So it lets the states make decisions that should belong to the individual. Disabled people already face worse healthcare access, high poverty rates, and systemic discrimination. And so having a disability, we all know, is extremely expensive. And depending on the needs, adding additional needs within this bill, it could very much cause individuals to go in to poverty even more. And so sometimes with IVF, what happens is you might have leftover embryos. And what this bill would do is it would actually say that the embryo is actually a person. And so that is also a concern because if somebody has an embryo in storage, there is a cost to that. It requires travel, but it also requires a storage cost. Or it can also, so what would happen is if somebody decides to terminate their embryos, it would just be unthawing, that could be illegal, and the person making that decision could go to jail. And so this is where this bill is concerning to us. And then just overall with the high unemployment rates with people with disabilities, we don't want to see costs go up even more because we already have excess expenses and already in a lot of times poverty. So where do things currently stand? Okay, so we do recently, it was about 2 weeks ago, there was a hearing and there was lots of testimony. Some are supporting this bill and some are in opposition. But there is another hearing coming up on November 18th. They are not going to take any comments. But this is a great chance for you to be involved, to hear the conversation. And also, if you do not support this bill, this is something that you can also contact your state member of the General Assembly to let them know your feelings around this. And so we are doing, as Able South Carolina, we are doing everything that we can to make sure that they know the concerns around people with disabilities. We do not want to see any loss of life. We don't want to see people go further in poverty because of excess expenses. And we definitely do not want to see people go to jail. Next slide. And so I'm not going to go through this chart. We're actually going to send this all out to you. But this is a great chart that just talks about the proposed changes, what that means, and then the current law so that you can see what would actually be the changes and where we're concerned. And then I'm going to pass it to Larry oh, I thought this was the last one, but I'm so sorry about airport regulations. So there's a lot of changes regarding for people that use wheelchairs and other disabled passengers.
And it is me again, surprise. I just keep sneaking in. Yes, so we want to make you aware of a shift in what had been in play before when it came to regulations for travel for wheelchair users and disabled passengers. There's been a few changes. So let's go on to the next slide and yep, perfect. So last year, US DOT, so the US Department of Transportation, found that around 5.5 million Americans use a wheelchair, and data shows that for every 100 wheelchairs or scooters transported on flights in the US, at least one is damaged, delayed, or lost. That's a significant amount of damage to people that require this kind of mobility device. So huge impact. Back in December of last year, the U.S. Department of Transportation proposed new rules to improve air travel for passengers who use wheelchairs. And those rules included better training for airline employees who assist passengers with disabilities and wheelchairs, and required onboard wheelchairs or OBWs to meet better performance standards for onboard wheelchairs. And this would essentially make flights more accessible and safe. And then better protections against wheelchair mishandling. So when wheelchairs become damaged or delayed during transport. Next slide, please. So what's currently going on? In February, so not 2 months after these new regulations were proposed, in February of this year, major U.S. airlines and the trade group Airlines for America filed a lawsuit that challenged that rule. They argued that US DOT did not have the authority to propose the new rules. So in response, US DOT delayed the enforcement of certain parts, and those parts are also called provisions of the rules. So as of September, the end of September of this year, so almost a month ago, the enforcement of 4 specific parts or provisions. Airlines must train staff on handling wheelchairs. Airlines must reimburse passengers if their wheelchairs are damaged. Airlines must provide notice of rights to passengers who use wheelchairs. And airlines must provide accessible onboard wheelchairs. So those 4 parts have been postponed until December 31st of 2026. So next year, quite a ways away. Next slide, please. So what does that mean for the disabled population? These delays mean that passengers who rely on wheelchairs without the better protections, or essentially have left those passengers who rely on wheelchairs without the better protections that are intended by the original rule. Some parts of the rule are still in effect, but other important protections, like the airlines being responsible for damaged wheelchairs or reimbursing passengers when flights aren't accessible, those are delayed and they're not enforcing those. This mainly hurts people with disabilities and violates their rights as travelers. So as things progress and as more updates come out, we will, of course, update you all and provide that information, but we wanted you to be aware of these changes. All right, next slide, please. And then we are going to talk about Advocacy Day in 2026. So I want to talk a little bit about what Advocacy Day is if you're not aware, and then how you can get involved. So next slide, please. So in a nutshell, Advocacy Day for Access and Independence is an annual rally at the South Carolina State House, and it is also live streamed virtually. Every year, Advocacy Day focuses on the main issues that South Carolinians with disabilities care the most about. This year, the issue areas are all about inclusive community living, and that includes employment, transportation, housing, and healthcare. So let's go on to the next slide. This year, or well, rather next year, April 14th, Tuesday, April 14th, 2026 is the day of Advocacy Day. We're holding it from 10 a.m. to 12 p.m. We're doing it at the South Carolina State House North Steps, and that's 1100 Gervais Street in Columbia, South Carolina. And we also will live stream this virtually. So you'll want to visit www.able-sc.org/advocacy day to read more information. And the reason why I'm giving you kind of a flyby overview of what Advocacy Day is because I would love for you to email me and reach out to me so that I can answer any questions you might have, talk with you more about what it would look like for you to get involved. Please email me at springgate, altogether at springgate is altogether, at able-sc.org so we can chat. Let's go on to the next slide. All right, some more information that would be helpful for your own individual advocacy. The 2026 legislative session is going to begin on January 13th of 2026. So you'll want to stay tuned for our email alerts, our social media posts, so that you can keep up with updates and ways to get involved. So if you're not following us or if you're not subscribed to our email blast, please do that. And we can also help you do that if you have any questions. And then also I wanted to draw your attention to a really useful app called the South Carolina Legislature mobile app. And that just makes it easier to keep up to date with what is happening at the South Carolina State House. And if someone could just pop that in the chat as well, I know that that would be helpful aside from the hyperlink. All right, next slide, please. And then just some information about how to connect further with ABLE South Carolina. Please use us as a resource. That is what we're here for. Our staff are always available to explain policies and laws, to talk with you about how to better speak up or how to increase those skills. We want to connect you with tools to advocate effectively. Pay attention to our alerts. We send timely updates on what the government is doing by email and social media. Please email advocacy@able-sc.org if you need help with your advocacy efforts. Ask for me, Allie Springate. I'm the Director of Advocacy if you call us. And then adults with disabilities can always join our monthly Empower Hours with Dory Tempio, who's our Senior Director of Community Education. And then youth with disabilities, ages 13 to 28, can engage with our EQUIP group led by other youth with disabilities. And then next slide. And then more information about how to connect with your lawmakers. Write letters, call, try to meet your lawmakers in person. You don't need to be an expert, you just need to share your story. It's all about honesty and transparency and connecting with people. Use short, clear messages. Share how the issue affects you, how it affects your family, how it affects your community. And then a really good rule of thumb is to ask for a very specific action. Please vote no on this, or please support this, whatever that happens to be for you. You can use our letter form, which honors the ADA, the 35th anniversary of the ADA, and you'll see a link there that will take you to that letter. You can also look up your legislator by using the link following that as well. And of course, we'll send all of this information out after this webinar so that you can access this information as well. And then those links are in the chat too. And then next slide, please. And we want to connect you with trustworthy sources. We really believe strongly in being informed, but really being well informed by disability experts, disability-led organizations. So stay informed. Be aware of what's going on around you as much as you have the capacity to handle, because I know it can be quite overwhelming. So we encourage you to follow trusted disability organizations to track these policy updates. So some options that we have listed on this screen are the National Council on Independent Living, or NICL, the Autistic Self-Advocacy Network, the American Association of People with Disabilities, and the American Disability Aging Alliance. All right, and I think the next slide is back to you, Kimberly, I believe.
Right. And I wanted to just share this. We are doing a campaign. We are All Able South Carolina, and it's a crisis campaign. If you want to support our work, please feel free to go to this website, and we're going to put that in the chat. But we are currently in a little bit of a crisis just because of some of our grant funding has been pulled because of DEI concerns, DEI issues. And so that's diversity, inclusion, equity, and accessibility. So we are currently trying to recoup about $350,000 to be able to continue this work and continue to fight for South Carolinians with disabilities. And I think we're going to go next slide, and I am pretty sure, yes. And so we are going to open it up for questions. So we will give it to the audience.
Okay, guys. Thank you to our awesome speakers this evening for covering such in-depth topics in a way that we were able to knock it out in right about an hour. So we're hoping to stick around with y'all until maybe about 7 o'clock. So we've got some time for Q&A. You can use the question and answer feature, the Q&A feature in Zoom to type your questions and send them to us, or you can ask to be unmuted so you can ask your question out loud. So as a quick recap, things we talked about today: Medicaid and Affordable Care Act changes, SNAP changes, and the Governor McMaster's executive order, federal budget proposals for critical disability programs, federal staffing reductions, South Carolina Bill S323, also known as the Unborn Child Protection Act, changes to airport regulations for wheelchairs and disabled passengers, and a reminder about Advocacy Day 2026 and some of the other ways that you can connect with us and with your lawmakers and with your community. So we'll open it up for questions now. Don't be shy. Use the Q&A feature, use the chat, and please ask away. Also, if you maybe have questions about other items, maybe things that we covered in the July version of our town hall, we would be happy to answer those too.
You can ask us anything.
Yeah, we can open this up for Ask Me
Yeah.
Anything if we want to. But yeah, absolutely. Please don't hesitate if you have a question. I know some of these topics are complex and can be really frustrating. But I also want to share, maybe you leave today and you realize you have a follow-up question after today's session ends. We have provided you with contact information. You are more than welcome to contact us afterwards with any questions that you have as well. We are very much open door here at Able South Carolina. We want to talk to you. We want to engage with you, our community. We want to hear what your thoughts are. So please don't hesitate to ask now or ask later.
And we do have a question from Callie Sandel. Are 504 plans at risk?
So currently within the Department of Education, 504s are actually not at risk currently, because that 504 is actually overseen or oversight is within the Department of Justice. And so in South Carolina, the Department of Education actually does not provide oversight over Section 504. So there is very little oversight for those services. And so we definitely encourage you, if you have any questions, to please, contact us. We'll be happy to help navigate any 504 plan concerns or issues that you may be experiencing within the school.
Thank you, Callie. Last call for questions. Okay, we've got one in the chat. Oh, excuse me. How can we get people to really understand the severity of things? I have been shouting through the roof for anyone to hear, and it is just so defeating.
Mhm. Yeah, I would say to keep sharing stories, keep sharing the real life stories that are impacting people with disabilities. In a couple of weeks, November 1st, I think people are going to start seeing the ACA rates go up. They're going to well, at least get notification that they're going to go up on January 1. And I think that there's going to be a panic because we're estimating that a lot of people will lose coverage and not be able to afford insurance. So, keeping up with what you're seeing from the reliable sources, sharing as much information as you can, but also just connecting it to real life is what what we have seen that has worked. Telling the stories of people with disabilities, telling the story, telling and most importantly, I will say, just making sure people with disabilities are not forgotten. And that is usually some of the issues that we experience with any of these barriers that impact us. A lot of times people with disabilities are afterthoughts. And so keep sharing, keep asking questions. Where are the people with disabilities? Have you consulted with people with disabilities? And I will tell you, all of these threats right now, there has been no consultation with any disability organizations or individuals with disabilities themselves. So keep being loud. So keep shouting it and linking those stories.
Thank you. Thank you. Any other questions for this evening?
I did just want to add one more thing to that last question. I think that's such a timely thought right now is just how defeating so much of this can be and overwhelming it can be when you feel like you are communicating and not being heard. And just a little plug for our peer support services. That's what we're here to do as well, is to be a sounding board, be peer support, be people that you can use as a resource to bounce ideas off of and ask hard questions and vent. We're here to provide that. We get it. Over 80% of us have a disability. We're disability led, so this is literally our lives. So that I just wanted to add that as well, that we encourage you to reach out to us just as people that you can trust to understand. So I just wanted to add that.
Mary Alex, just to let you know, there are 3 open questions in the question
Yep.
chat.
I've got it, Dory. Thank you. I've got it open right now. So we'll go to the first one. We have a question of how much of the needed $350,000 for the fiscal year deficit has been raised to date. And I do want to mention that we launched our campaign a week ago.
Yeah,
So,
and I'm really proud to say that so far since we launched our campaign, we have been able to raise $58,000. So we are extremely fortunate. We had some wonderful people that were able to give us large chunks of change, but I will also say that many of our consumers and people with disabilities have invested, even if it's $10, it means the absolute world to us, especially seeing it with our own community that we serve. So thank you for that question.
yes. Thank you. And we know that multitudes of small donations are really what's going to get us over the finish line here. So we appreciate every dollar that anyone is willing to give. Thank you. Thank you. Please do spread the word, share the word. We have content on our social media about this campaign, and you can also share that link that we provided. The next question is, as a DSP, how can we best help our program participants, especially in the independent living and employment programs?
Yeah, absolutely. I think there are lots of opportunities, obviously, with the skill building, teaching rights. I think that's going to be even more important as we continue through some of these changes, teaching those rights, and so that giving them the ability to be able to advocate for themselves, and as a DSP, making sure that what we're being very cautious of is just not sending somebody to a resource because that resource may no longer be available. And so making sure that you're doing handoffs, making sure that they're still providing services. I know a lot of services within some organizations are expected to significantly decrease. And so that is something that I would say with employment, keep pushing employment, keep helping folks get employed. There's going to be lots, hopefully, continued efforts and lots of opportunities out in the field for employment and then just independent living skills. Really, I always say just looking at what skills they're really needing to work on, and that looks different from every single person. And also, everybody is so unique and individualized. There's never one size fits all. So, individualizing your independent living skills is critical. Anyone else?
I'm not seeing any other questions populating in our question and answer feature here. So last call for questions this evening. We'd love to hear from you. Okay, and I'm just going to switch us over to our next slide. So here's just some information about how you can stay in touch with us, our website, main email address, phone number, et cetera, et cetera. You can also join our email list by texting ABLESC with no spaces to 72572. And then you can follow us on social media. We're on Facebook, Instagram, X, formerly known as Twitter, LinkedIn, and we also have a YouTube account. And YouTube is where you'll be able to find a copy of the recording of today's session. So please do join us in those spaces. And before we go, I do want to give a final shout out for another opportunity that you have to engage with Able South Carolina coming up in just a couple of short weeks. We have our annual fundraiser event that we call Fundable. If you go to our website, at able-sc.org/fundable. You'll find details about that fundraising gala and awards event there, where we also have tickets on sale. We would love to see you at the event to celebrate with us, to celebrate the many wins that we did, in fact, have this year. It can be really frustrating to listen to some of these policy changes and things and expectations, but we also have quite a few wins that we have to celebrate as well. So we're going to have a great evening celebrating disability-led community, disability pride, and celebrating with you. So we hope you can join us at Fundable on November the 7th. That is going to be at Central Energy, which is a venue in downtown Columbia. And we hope to see you there. Again, you can always find us on our website, give us a call, find us on social media. We've provided links where you can email us questions you might have after the fact, because yes, we provided you a ton of information, but we so sincerely appreciate you being here, and we will send a follow-up email with copies of tonight's presentation. All right, thank you for the hand clap emoji, whoever sent that. Okay, well, we're going to call it a night. It is almost 7 o'clock. Thank you again. We sincerely appreciate you. And until next time, this is a quarterly occasion, so we will probably see you sometime in late January, early February with another town hall event. Thank you, everyone, and have a great evening.